Now, this is a tricky thing anytime someone is in the position of trying to do anticipatory response, is that it is the job in doing anticipatory risk mitigation to assess the scenarios we don't want to have happen, to propose remedies to prevent them from happening. Then people who have status quo bias afterwards will say, see, it was overblown hype, those things didn't happen. But they only didn't happen because we made the responses. We have a situation where we have to act without complete knowledge. The time that it takes to get complete knowledge, the underlying situation is changing. So inaction is also a kind of action. Nationwide quarantines has a massive effect on people's mental health, on the underlying economy, on lots of things. And not doing it has a massive effect. There are still a lot of people who think that the risk of quarantine is worse than the risk of not, and that the viral risk itself is overblown. So comparing the death rates to the flu and seeing that a lot less people have died, and then thinking that it's overblown and it's some kind of either state agenda to concentrate control or mass hysteria or something like that. Because it's a baseline we've had every year, we have ICU capability for that. We don't have ICU capability for spikes above that. And that's where we start getting catastrophic collapse of the medical system that leads to much worse problems. So if a similar number of people got COVID-19 as got the flu, the death numbers would be catastrophically higher, because the percentage of people that need hospitalized and go into critical condition and the percentage of people that die, even factoring the whole range of what that can be, is radically higher. The total number of people exposed so far is tiny compared to the flu, but it won't stay tiny if you don't do containment. It is spreading enough that if you don't contain it, you could get saturation. You'd get saturation in about 2 months, meaning a 60-70% of the population has it globally from where we currently are if containment efforts didn't get put in place. Containment efforts can, of course, slow that curve and even stop the curve, depending upon the nature of the containment, which will make the total number of infected people and thus hospitalized people and deaths much, much lower.